I'd like to welcome you to the Joint Adventure Pre-Op Joint Replacement class. My name is Laura Vaughn. I'm a registered nurse, and my job here at the hospital is the Joint Center Patient Navigator. I have this job because I have been a nurse for more than 40 years, and my experience has been in working in same-day surgery, the operating room, the recovery room, and for over 30 years on the orthopedic floor of the hospital. So I literally know joint replacement inside and out. You guys are watching this video because your doctor probably told you to do so. But it's important because when I started being a nurse, you used to stay in the hospital for about 2 weeks following joint replacement surgery. Now you will probably be in the hospital overnight. Some of you will go home the day of surgery, and a few of you might stay 2 nights in the hospital. So a lot of your recovery time is occurring at home, and we want you to know how to take care of yourself and how to prepare for that. And that's what we're going to discuss in this class. Your experience may be a little bit different than what we're going to talk about, because what we are geared to here is how most people experience joint replacement surgery. Anytime your doctor says anything different than what you hear here or read in the guidebook, you follow your doctor's instructions. There is an accompanying guidebook that goes with this class that you can access by going to johnstonhealth.org, click on Care and Treatment, click on O, then click on Orthopedics, and then Joint Replacement, and you will find the Joint Adventure Guidebook online. First, we're going to talk about people that you're going to meet in the hospital. The first person you're going to come in contact with is a pre-admission testing nurse. You will either receive a phone call or have an appointment with them. It's important to have insurance information available, a photo ID, a complete list of your medications with you, and knowledge of your health history, because what these nurses are going to do is get your chart together and prepare it for your admission to the hospital. It only takes a few minutes, but like I said, it'll either be an appointment or a phone call. Some people will need to see a cardiologist or your primary care practitioner for a clearance before surgery. The nurses will tell you what kind of lab work you need and if you need clearance, and they will help arrange all of that for you. Now we're going to talk about what the case managers do.
Hi everyone, my name's Kat. I'm the surgical social worker here in Smithfield. I'm going to be talking to you about what you're going to need when you get ready to discharge from the hospital, which, as Laura mentioned, will be the day after surgery for some of you, the day of surgery for others, and 2 or 3 days after surgery for others, just kind of depending on your surgeon, how you're doing after your surgery, and what kind of surgery you had. We're going to be talking to you about things like what you're going to need when you do get ready to go home. As Laura mentioned, most of you will be going home. That is our preferred discharge plan for patients. Some of you will go home with outpatient physical therapy. That is the plan if you are with the Emerge Ortho group, which is Dr. Romine, Dr. Rosenberg, Dr. Bowman, and Dr. Bagsby. They will prefer you to go home with outpatient physical therapy, and we encourage you, if that's not going to work for you, to talk with them ahead of time. They will schedule that appointment before you have surgery. And if that, again, is not going to work for you, please talk with your surgeon and with the community case manager in their offices. Her name is Judy. Additionally, if you're with Dr. Tayrose and Dr. Alioto, they will prefer you to go home with outpatient physical therapy or home with home health care. Now, with home health care, we encourage you to contact your insurance company ahead of time to determine what agencies are preferred by your insurance. You'll have a list of home health agencies and medical equipment companies in your booklets that will tell you the different agencies in the community. And we encourage you, if you have a managed Medicare or a private health insurance, to be talking with them ahead of time to determine what agencies are in network and what are preferred by your insurance company. If you have traditional Medicare, the red, white, and blue card, you do not need to call your insurance company. Everything's in network, everything's covered. If you have Medicaid, which is the gray card only, you cannot go to a skilled nursing facility. Your discharge plan will absolutely be home with home health care or home with outpatient physical therapy. Again, if you know that going home is not going to work for you, please contact your surgeon and the case manager if you're with Emerge Ortho ahead of time to determine other options for you, because they have other options they can put in place for you. You will be meeting with the case manager most likely the day of surgery or the day after surgery, depending on when you have your surgery and how you are doing with recovery and anesthesia and things like that. So if you have any questions, please let us know. You can talk to the case manager when you come in, or ahead of time you can contact us at the number in the book, or you can contact Laura and she will reach out to us. So thank you everybody, and I hope all your surgeries go well.
Hi, I'm Wanda. I'm one of the physical therapists here at Johnston Health, and I'm going to talk to you a little bit about what to expect with your therapy during your hospital stay. If you'd like to reference some of this in your booklet, you can turn to page 12 and take a look. So first of all, I'm going to tell you a little bit about the difference between physical therapy and occupational therapy. Physical therapists are going to deal mostly with you getting up, moving around, and occupational therapy deals mostly with the upper body and what we call activities of daily living. So things like, can you comb your hair, brush your teeth, put your shirt on, zip, button, feed yourself, those types of things. Now, some of you may not see an occupational therapist while you're here in the hospital, but if your doctor orders an occupational therapy consult, the occupational therapist may come in and check you out. If you're not having any problems with using your arms right now, we don't expect that you'll have any problems after surgery. We just like to let you know that an occupational therapist may come and see you. Physical therapy, however, will be coming to see you every day while you're in the hospital. We'll be working on your mobility, getting in and out of bed, walking around, moving, doing those types of things. We'll also take you to our Joint Center rehab room, and you can see pictures in your booklet on page 12. And we have a high-low mat there with room to move around. We have a set of parallel bars so we can do standing activities. We have a set of steps so we can practice steps and stairs. We also have a car simulator so we'll practice getting in and out of the car. And also we have a mock-up kitchen so we can practice doing things that you would normally do around the house. And this will give you an idea of if you feel like you're ready to go home and ready to do those things that you'd normally be doing during the day. Also, in your packet, there will be a sheet that is kind of a reference for you what to expect during your hospital stay. Laura is going to be telling you a lot about this stuff, but on day one of your surgery, you can expect therapy to come by and check on you. Depending on what time of day you have your surgery and what type of anesthesia you have, you may or may not be able to actually participate in a lot of therapy that day, but we will have a physical therapist coming to check on you just to kind of see what you can do and get you started. Definitely after that first night's stay, we will get rolling with your therapy. We'll be doing exercises and increasing each time that we see you. We'll be doing walking. Our minimum requirement for you to be discharged is to walk at least 25 feet. Most people are walking much further than that, but 25 feet is a minimum distance that we know you will be functional at home and be able to get from point A to point B when you're there safely. So next I'm going to talk about precautions for total knee patients, total hip patients, and total shoulder patients. So for the total knee patients, the only precaution that we'll have is that after your surgery, we would like for you not to put any pillows under the knee that you have surgery on. We don't want your knee to lay in the bent position for an extended period because as your body's laying down scar tissue, that scar tissue is more firm than your regular tissue, and your knee could end up being in that bent position for a while. And the straightening motion is a whole lot harder to get back than the bending motion after knee surgery. So we would like for you to lay with your knee flat in the bed after your surgery. We will help you get comfortable and make every effort to keep your pain controlled, but no pillow under the knee for the knee surgery patients. Now, for the hip precaution patients, everyone is going to have a couple of the same precautions. First of all, we do not want your surgical leg to cross the midline of your body, so it needs to stay on its side of the body. Second, we don't want your leg to rotate excessively in or out. The third precaution for anterior hip patients who are Dr. Bagsby surgeries, we do not want you to take your leg back behind your body like if you were stepping backwards. For our posterior hip precautions, which are all other surgeries, we do not ever want your knee to come above the level of your hip, so you never want to go greater than that 90-degree angle. Now, for our total shoulder patient precautions, you're going to be in a sling/immobilizer after surgery. So when you are ever out of that sling, we never want your elbow to drop down below your side. So we never want you not to be able to see your elbow when you're looking down. Your elbow needs to stay out in front of your body, so to speak, so that you're not getting in that awkward position or that extended position. This first thing we call a reacher, and you can use this for picking up objects that aren't close enough to reach. For instance, if you have your recliner and your table set up at home with your water and your remotes, keep your reacher close by, because if there's something just out of reach, you can reach over and snap it. You can reach down and pick up things off the floor. Also has a little magnet on the end. If there's something metal and you need to click it, you can reach up and pick it up. So that's the reacher. The next thing is a long handle bath sponge. It's really good if you can't reach your back, don't have anybody to wash your back. Also, women like it if they're going to put cream on their legs. They squirt their cream on the sponge and then they can rub it all over their legs without having to bend over. This is a long handled shoehorn. Men really love this, so you can get your heel down into your shoe without bending over. Everyone likes that. The last thing many of you have probably never seen, and this is called a sock aid, and I'm going to take my shoe and sock off to demonstrate this. So to use the sock aid, you want to take your sock and thread it up to the toe. I wear shorty socks, but it works well with long socks also. Just thread it all the way up to the toe. Take your jump ropes and you're going to toss it out just in front of your feet. And then you're going to point your toe a little bit and you're just going to slide the sock aid right up your foot and all the way up your leg if you have a long sock and it puts your sock on. And that's how you use that. Like I said, go ahead and start practicing with this now. It takes a little bit to get used to doing it and get where you're good at it. But with lots of practice, these can really help you out at home. In your patient booklet on pages 21 and 22, there are some exercises that we'd like for you to start doing before your surgery. We'd like for you to start doing them today and do them twice a day, every day until you come in for surgery. You can start out doing them about 10 times each, and you can gradually go up by 5 times if you're comfortable doing 10 times and that doesn't bother you at all. Go up to 15 and so on. So you can work yourself all the way up to 30 if you'd like. The first exercise is called a quad set. So the quads are the big muscles on the front of your thigh. When you do a quad set, you want to press your knees down and hold it for a few seconds and then relax. Now you will need to be either sitting like I am or lying flat, and you can do this on your bed, or I've even had patients do it on their sofa if it's firm enough. So anywhere that you can get on and off of comfortably, you can do these exercises. So again, the quad set, pressing the knees down, holding for a few seconds and relaxing. The next one is called an ankle pump, and this one is exactly what it says. You're going to pump your ankles up and down. You can do this sitting like I am. You can also do it sitting in a chair, tapping your toes. You can do it standing up, tapping your toes. Ankle pumps are important not only because they work the muscles of the lower legs, but because they keep the fluid pumped through the legs and the body, and they help prevent blood clots. So when you're in the hospital, we will be reminding you frequently to do your ankle pumps. The next exercise is called a short arc quad. So again, we're working these quads. In the picture in your book, you'll see a ball under the patient's knee. At home, you can fold over a pillow or roll up a blanket, anything to prop your knee on to hold it up. And with this exercise, you just want to straighten your leg as straight as you can get it, and then nice and easy back down. That's all there is to it. Just up and right back down. Now with this exercise, we'd like you to do both legs, not just your surgical leg, because we want both of your legs to be as strong as possible before your surgery. The next exercise is a pillow squeeze. So we want you to put a pillow between your knees and squeeze together and hold it for a few seconds and relax. That's all there is to it. So squeeze together and relax. You can do this exercise in sitting like I am, or you can do it sitting in a chair or standing up as well. The fourth one that we're going to do is going to be a heel slide. And with the heel slide, what you're going to want to do is to slide your heel up towards your butt, far as you can, and right back down. That's all there is to it. Again, we want you to do both legs. This exercise is mainly for range of motion and stretching, because we want you to have as much flexibility in your joints and muscles as you can before you come in for surgery. And the last one, and probably the most important one I'm going to demonstrate, is bridging. You will have to lie flat for this one. We want you to lie flat with your knees bent up. And when you do the bridge, what you want to do is lift your hips up and make a bridge underneath your body, and then right back down. So again, that's lifting hips up and right back down, And this is important because when you get in the hospital, you're going to get stuck in a hole in your bed, and when we come in to get you up, we're going to say, we need you to scoot your hips to the edge, and you're going to have to lift up and scoot, and lift up and scoot. So if you'll do these exercises every day starting now until the time of your surgery, you'll be much better prepared when you come to the hospital.
One thing I want to clarify is that the medical equipment that everybody needs whenever they get home is a walker and a bedside commode. The walker, if you have one that you want to bring to the hospital, we can use yours, but we can also provide one for you while you're here. The case managers arrange for the equipment for you. The bedside commode is not for you to put beside your bed and use as a bathroom. It is something that you take the bucket out and you put it over the top of a toilet, and now you have a raised toilet seat and handles that make it easier to get on and off of the toilet. The other thing that you can do is put it in the shower and use it as a shower chair, because you're not going to be able to bathe and reach down and wash your feet. So when sitting in the chair, you're all set up to take a shower, and it is for your convenience that we provide these things. The other thing I'd like to talk about is how we decide who goes home the day of surgery and who has to spend the night. Wanda said it has a lot to do with your surgeon and how you're doing, but walking 25 feet, being able to go to the rehab room and do stairs and get in and out of a car, and your pain being managed with oral pain medication is how we decide when to send you home. That being said, what we're going to talk about now is the rest of the people that you're going to meet in the hospital. Of course, you're going to meet your orthopedic surgeon there, and if you stay more than one night, you'll probably see the physician's assistant too. You're going to meet an anesthesiologist the day of surgery, and the CRNAs and the anesthesiologists are the providers that help you not care that you're having surgery, but more importantly, wake back up from not caring that you're having surgery. Registered nurses are the eyes and ears of the doctor. While the doctor isn't available for you, we monitor your pain, your vital signs, your wound, your activity, and we contact the doctor if needed. Certified nursing assistants are the people who help the nurses help you. They can help you reposition in the bed. They can get you a Coke if you need a drink. They can help you get to the bathroom. They can assist you getting in and out of the bed, up and down to the chair. You also meet a respiratory therapist. Everybody who has joint replacement surgery overnight has oxygen. Whenever you are recovering from surgery and anesthesia with pain medicine and with the anesthesia in you, people tend to breathe shallowly, so we support that with the oxygen. It's just a safeguard for you. We also have people who spend the night wear a pulse oximeter on their finger that it clips on, has a little red light that monitors the oxygen levels in your blood. And so everybody has that. So you will see a respiratory therapist. A dietitian you may or may not meet. If some of your lab work comes back showing that perhaps you're diabetic and your A1C is too high or your protein levels are low, we will request the dietitian come and talk to you about supplements or your diet. If you have special dietary needs, we may also ask the dietitian to come and talk to you so we can meet your needs so you can eat the food that you normally eat at home. Spiritual care is available for a word of prayer. They are also the in-house experts on advanced care directives. If you need information about living wills or healthcare powers of attorney, ask to speak with a chaplain and we can get you more information on that. The pharmacist is involved in your care, but you probably won't ever get to meet that person. They monitor the medications that you're on. They monitor how you are reacting with the medications. They monitor if you're on something that may be in conflict with another medication. Another thing that they do is if you have prescriptions that you need filled before you leave the hospital, our pharmacy will come and get your prescription and fill it and drop it off in your room before you leave the hospital. I am what they call the orthopedic patient navigator. And what that means is I'm the lead teacher in the classes and I keep our information current. One of the things that I do is whenever after your surgery, and it's a year from now and you're no longer seeing your orthopedic surgeon and you have a question, regarding your surgery. As long as there is a joint center here, you will have an orthopedic patient navigator. One of the most frequent calls that I get about a year out is, am I going to set off a metal detector? And the answer is, I don't know. I literally have a patient who will set off the metal detector at PNC Arena, but not at the RDU airport. The way to go through TSAs is to inform whoever that you have had a joint replacement, and then they will either wand you or let you walk through. That's how we get through that. You can always contact the navigator. The number is on the web page for the hospital and also in your joint guidebook. We'd like you to have a coach, a support system set up before you come in the hospital. When you used to stay in the hospital for 2 weeks, we were able to help you here, but now you're going to be doing the majority of your recuperation at home. You need to have somebody who has a driver's license and can help you with transportation. You need to have somebody that is strong enough to help you get up from a chair if you need it. You need to have somebody that can be available in case of an emergency. And you need somebody who can help you with your exercises if you need that. That is the responsibilities of a coach. You can have a family member, a friend, just try and set it up before you come in the hospital. If you don't have anybody, make sure you let your doctor know so we can help you with other arrangements, because we can do that too. The reason that people need joint replacements is there is a space in between your joints that is filled with fluid, and it's contained with some cartilage. Through illness, age, and trauma, injury, the cartilage breaks down and the fluid can become smaller, which leads to what the physicians and probably you call bone on bone. And what happens with that is your bones just keep eroding each other because there's no shock absorbers in there anymore, which leads to the damage to your bone and your pain and the need for a joint replacement. Okay, we're going to talk about getting your home ready. The first thing I want you to do is go through your house and pick up any throw rugs, any drop cords, anything that you might trip on. Walk through your house and make sure you have enough room for a walker. If you're walking and you put your arms about like this, that's about how big a walker is. Pay special attention to your bathroom doors because bathroom doors, for some reason, are often smaller than regular doors. And if you need to go in sideways with your walker, we need to practice that before you go home. When you're coming home for the first time, oftentimes, if you have pets, cats are going to want to do this. If you have dogs, they're going to want to do this and hop up on you. If you have little kids in your house, they may want to come up and give you a big hug. Those are all fall risk hazards. As you're coming home for the first time, and usually this is the only time that pets and children want to become a trip hazard for you, put your pets and put your kids in the bathroom and shut the door. Then you go and sit down in a chair and get a clean sheet and put it over your lap or your shoulder, and then the kids and the pets can come and safely greet you and welcome you. The sheet is because pets and kids are really germy, and we want to keep you as far away from germs as we possibly can. As you go through your daily activities, pay attention to what you may have to reach up for or what you may have to bend over for, and try and put things on one level so you don't have to be reaching and falling. You may want to invest in some extra products. Ice packs are a good thing to have. You can make them easily with half rubbing alcohol and half water in a Ziploc with a washcloth in it and freeze them. That's an inexpensive way. Ice packs are good whenever you're traveling back and forth to the doctor's office or back and forth to physical therapy, because icing your joint 20 or 30 minutes before therapy and 20 or 30 minutes after therapy really helps control the pain. Extra pillows. Joint replacement surgery has a lot of swelling associated with it. And for comfort and for dealing with the swelling, you may want to prop things up and manage your swelling and your discomfort that way. A footstool or a recliner will also make you more comfortable because you're going to have your feet elevated that way. It is more comfortable for people with shoulder replacement surgery to actually sleep sitting up for a week or 10 days because of the swelling. When you lay down, it can come and get swollen all up your neck, and many people with shoulder replacement surgery are more comfortable sitting up and sleeping. An oral thermometer is useful because one of the first signs of a wound infection is getting a temperature of 100.5 degrees or greater. It is nice to have a big pocket shirt or a little basket to put on your walker, but the most convenient thing is you get a grocery bag and flip it around your walker to carry your supplies. What happens whenever you're walking and you try and carry everything, that as soon as your cell phone starts falling, then you quit thinking about your balance and your posture and your walker, and you may trip. So if you have a container, you can put your medicine, your glasses, your phone, whatever you need to carry around with you. It helps you with fall prevention. If you use tobacco products, stop now. Tobacco products hinder your ability to heal a wound in there. They like you to stop before surgery and 6 weeks after surgery. And I might add, if you can stop for 6 weeks, you should just stop smoking because it really will affect your life in a good way. We are going to be questioning you about what kinds of medications you take. It's very important that we stop anything that is a blood thinner prior to surgery, which is why we ask you on a number of occasions what kind of medicine you take, because we need to be sure. A lot of things besides actual blood thinning medicine can thin your blood. Advil or Celebrex can do it. There are some herbal products that can do it, and so that's why we ask you a lot of times. We want to be sure that you are not taking any blood thinning medicine. If you routinely take a blood thinner for another condition, you're going to stop it before surgery, and then we will get you back on it as you go home. People who have joint replacement surgery are at risk for constipation. Anesthesia, inactivity, different foods, lack of privacy in the hospital, and narcotic pain medicine all lead to constipation. Before you come into the hospital for 2 or 3 days, I want you to increase your fluid and fiber intake. It can be water, it can be juice, whatever you want to drink, just drink more of it. And extra vegetables and fruit, bran-type cereals, that kind of thing, helps you prime the pump whenever you're coming into the hospital. In the hospital, we recommend a high-fiber diet. You'll be on a stool softener while you're here, and probably whenever you go home, you will be too. But have a laxative at home available just in case you need it, and then you won't have to go out and buy one. Infection prevention before surgery. In pre-admission testing, you will receive a special soap that you bathe with. When you bathe with the soap, I want you to use clean washcloth, clean towels, clean sheets on your bed, clean pajamas, because once you shower with the soap, or wipes if you get wipes, we want everything that you come in contact with to be just as clean as it possibly can. There are 2 basic kinds of anesthesia. There is general anesthesia, which involves a breathing tube down your lungs, and if you watch television shows, this is the kind that's usually depicted on TV. There are regional anesthesias that are spinal or epidural ones, which involves a catheter being placed in your back and medication, and you will be numb from about your waist down. With either of these, you will not be aware that you're having surgery. You'll meet the anesthesiologist the day of your surgery. He or she will have reviewed your records already and have a plan in mind for what is best for you. You have a voice in this too, so please be sure and discuss any concerns you have with your anesthesiologist. The surgeons often prefer the regional anesthesias because there are fewer side effects following surgery, like nausea and vomiting, and it is easier for us to get you up and out of bed the day of surgery, which is our goal. Most of you will receive a nerve block, which works in a method similar to getting Novocaine for dental work, that lasts for about 12 hours following surgery. Some of you will get medication injected into your joint before they sew you back up, and that often lasts longer than 12 hours following surgery. It is important to remember why I'm saying 12 hours. Usually what happens is you're pretty comfortable the evening of surgery, and then sometime around 2 o'clock, 4 o'clock in the morning, you wake up and holy cow, you're hurting again. It doesn't mean anything is wrong. It means that your nerve block is wearing off. Usually it takes about an hour to get that back under control with pain medication, position changes, ice if you don't have ice on your joint. And that is, I'm told, the worst pain that you have following this surgery is when the nerve block wears off. Remember to not eat or drink anything the night before surgery unless you have been told to take some of your own medication prior to surgery. If you do, remember what you took and what time you took it, because they're going to be asking you that. The day of surgery, we want you to bring to the hospital loose-fitting clothes. You can wear a hospital gown if you want to, but most people prefer to wear loose-fitting shorts or to wear loose-fitting clothing so that you can get it on and off over a bulky dressing. And the rehab room is on a different floor of the hospital. We'll take you in a wheelchair down there, and a lot of people just feel more comfortable in a t-shirt and pants. Dr. Bagsby's patients want you to bring a pair of compression shorts that you can find in an athletic department of a store. Target, Walmart, Amazon, Dick's, those kind of places are where you can find the compression shorts. Non-slip shoes and slippers. We don't want heels, we don't want flip-flops. We like shoes with a heel that comes up over your heel in the back, just because you need a good sturdy shoe to do your therapy with. Personal toiletries. If you forget some, we have ones here at the hospital that you just have to ask your nurse or your CNA for. Toothbrush, deodorant, lotion, that kind of thing. If you have a BiPAP or a CPAP, bring yours and we will use yours. And if you don't know what that is, thank your lucky stars, because it's what people with sleep apnea have to use. Activities and reading materials. Every room has free Wi-Fi, free cable. There's music channel on the cable. There's a lot of waiting when you're in the hospital, and especially for your visitors. And something to keep them entertained is very helpful. One thing I'd like to recommend is if you have somebody with you at the hospital the day of your surgery is to leave all of this stuff in the car. If you come into the hospital with your suitcase, every time you go and get a drink or every time you need to use the restroom, you're taking that little suitcase with you. Following surgery, the doctor is going to come out and talk to your visitor, and then you get a room assignment from one of the hospital staff. After you've spoken to the doctor and have your room assignment, go out to the car and get your belongings and then take them directly up to the 4th floor joint center, and then you only have to carry it one time. If your surgery is on a Monday, they'll call you Friday afternoon and let you know what time to be here. Any other day of the week, they'll call you the afternoon before and tell you what time to be here. Normally, it's 2 hours before your surgery time. When you come in here, go to the front desk, and you will be taken to the same-day surgery department where they're going to start an IV and give you medications. One of the medications that they give you protects your stomach during the surgery. If you know that you get motion sickness very easily or are nauseated very easily, tell your anesthesiologist or your nurses, because we can give you extra medication prior to anesthesia to help control the nausea and vomiting. Nausea and vomiting is a very common side effect from anesthesia. You meet the anesthesiologist in same-day surgery. The surgeon is going to come in and sign the joint that you are having operated on with an indelible ink marker. This is probably one of the safeguards that you'll be awake for. We have many in place during the entire stay here, but this is one that you are going to be aware of, because you are a participant in saying, yes, this is the joint that's going to be operated on. Your family member or coach can stay in the same-day surgery area with you. Once you've been prepped for surgery, you're going to go to the operating room. You're going to be gone from your family about 4 hours for the anesthesia, the surgery, and the recovery time. But the surgery time itself is about 1.5 to 2.5 hours, depending on what kind of joint you're having replaced. You're going to receive an antibiotic through your IV, and you may be asleep whenever that occurs, but you're going to get one. The operating room staff will provide you with updates throughout the procedure. You'll be waiting in the surgery lobby, and the physician will come out when the surgery is over and talk with you. When you wake up, you're going to be in the post-anesthesia care unit, where you will stay usually about an hour or two down in there. We want you to be fully awake. Whenever you have anesthesia, your blood pressure drops, your temperature drops, your pulse drops, your respiratory rate drops, and we want it to be coming back up, because that means that you're recuperating from the anesthesia that you have received. You're going to have a really bad case of cottonmouth because of the anesthesia. That's one of the side effects from it. There is ice and juice and water available in the recovery room. Another thing that happens as you're recovering from anesthesia is you may feel very cold. We have warm blankets in the recovery room to warm you back up, and we also have them on the 4th floor joint center if you need one. Whenever you're fully recovered from the anesthesia, that cold feeling will go away. We also want your pain control to be established. When you wake up, you'll probably be in some pain. We'll give you some pain medicine, and whenever it's safe to, we will move you to the 4th floor joint center. The 4th floor joint center is on a wing that we try very hard to keep elective surgeries on that wing. It has less foot traffic, which means that people who may have the flu are not going to be traveling this aisle. We're trying to keep them on another wing of the hospital. There's all private rooms. We use something called a whiteboard at the end of the bed that has a lot of helpful information for you. It has the phone number to your room. It has your nurse's name and how to contact your nurse, your CNA's name, the charge nurse's name, when you had pain medicine, when you can have pain medicine next. It's helpful information for you as you recover. We do bedside shift report, which means that if your nurse is going home for the day, they're going to bring the next nurse in and introduce them to you at that point in time. This is a good idea for the ongoing nurse, the offgoing nurse, and you to talk about your pain management. Talk about when you can have pain medicine next, when you may need it, how much pain that you've had. It's just a good time to discuss this with everybody. We do purposeful hourly rounding, which means you're going to have a member of the nursing staff in your room every hour in the daytime, and then in the evening every 2 hours. And it's just so we can anticipate your needs and help you through your stay. Just make sure everything's all right for you. When you come to your room, everybody is going to have oxygen on through a nasal cannula. That I remember I said we're going to have that overnight. You're going to have an IV running. It usually has a big bag with fluid in it and a smaller bag that doesn't have anything in it, and it's supposed to be that way. That is where you received your medicine before surgery, your antibiotic before surgery, and as an infection control practice, we leave the system closed and we'll use it for the antibiotics that you will receive before you go home from the hospital. You may or may not have a Foley catheter, which is a tube that drains urine from your bladder to a bag on the bed. We try not to use them very much anymore, but you may be somebody that wakes up with one. And if you have one, it'll either come out at midnight or at 6 a.m. following surgery. Everybody's going to have a bandage on. If you have knee replacement surgery, you're going to have a very large, bulky dressing from about your thigh down to the sole of your foot. Knee surgery tends to swell quite a bit, and what we have on you is a dressing that's about this thick, wrapped in ACE wrap. If you have anterior surgery, Dr. Bagsby, it's going to be on the front of your thigh near your pelvis. If you have posterior hip replacement surgery, it's going to be on your outer thigh. And it's also going to be a bandage that's pretty thick. If you have shoulder replacement surgery, you're going to be in a sling like this and have a big bulky dressing up here too. You will have a gadget that resembles this on your feet. Where this heel is a balloon that blows up and goes down, and it fits around your foot snugly like this. It's attached to a cord that's attached to a box on the end of your bed, and what it does is while you are sleepy and can't do ankle pumps, then this helps promote your circulation and helps prevent blood clots while you're in the hospital. If you have shoulder or knee replacement surgery, you're going to have a cryotherapy unit that's called a Polar Care that sits and puts cold on your joint that is replaced. They don't work for hip replacement people, so if you are in need of some ice, and ice is going to be your best friend for several months following surgery, ask your nurse for some ice for your hip. We can give you that and put it on. The other equipment that you may have in the hospital is hip replacement patients may have a long leg brace on because that keeps you from doing some of the movements that you aren't supposed to do. And some knee replacement patients also get a knee immobilizer on them. Your diet in the hospital We use room service, and you get a menu that looks like this, and it's just like ordering food in a restaurant. You have to call in each meal. If you forget to call in the meals, they will call you and help you remember. One thing that I like to recommend is when you or your family member is ordering dinner, ask them to bring your breakfast the next morning around 7 or 7:30. You're going to have a kind of rough night the first night because the nerve block wears off, the nursing staff is in there monitoring your wound, monitoring your vital signs, and we're going to be in and out there all night, so you're not going to get a lot of sleep. And the second that we get you comfortable and we can stop checking on you, the lab's going to come in about 4 or 5 o'clock in the morning and wake you back up. Having your breakfast ordered the day before means that you don't have to worry about it or be disturbed by a phone call if you actually do get to sleep around 6 o'clock in the morning. Having your breakfast at 7 or 7:30, if you get up and get ready for your therapy usually comes between 9 and 10 o'clock in the morning. You can get dressed, you can go to the bathroom, you can have your breakfast, you can take some pain medicine and have it in your system before the therapist comes in. Pain medicine has fewer side effects if you take it with food, which is why we recommend taking it with your breakfast. Lunchtime, have them deliver it around 12 or 12:30 because therapy is going to be between 1 and 2 o'clock most likely. Your wound care in the hospital, we will change your dressing, usually from the bulky dressing, the first day or two after surgery and replace it with a smaller bandage. If you're in the hospital, please don't touch your bandages, don't stick anything down in between with your skin. If it itches, don't try and scratch it down in there, and because we want the dressing to remain in place and our germs to stay on our side and away from your incision. One of the complications that we worry about is blood clots. You're going to be on a blood thinning medication of one sort or another for about a month following surgery. During that time in the hospital and at home, every time a commercial comes on television, I want you to do ankle pumps, okay? Every hour, I want you to stand up and move around. This helps your circulation, it helps with swelling, it helps with pain, and it helps prevent blood clots. Another complication that we're concerned about is infections. We're going to give you antibiotics before your incision and following your surgery. For if you're in the hospital, we'll probably do it in your IV. If you go home, you'll probably get it in pills. Another thing that can happen is you can get a kind of pneumonia that is related to breathing shallowly. Most of you will get a device that looks like this that is called an incentive spirometer that helps you breathe deeply. What you do with it is you take a big deep breath in, and when you can't breathe in anymore, you hold your breath for a moment and then exhale. You'll do that 8 or 10 times an hour, and we will show you how to do this when you're in the hospital. One tip that I have for you is after you do the deep breathing is to take a drink of water or some ice chips because your throat is probably going to be very dry and sticky. And when you cough, you might get it stuck here. If you lube it first with ice or water, you can cough it right back up. And most people do end up coughing something up following surgery within the first 24 hours or so. Pain management is something that we are all concerned about following surgery. The pain scale we use is 0 is no pain and 10 is the worst pain that you can imagine. I have good news and I have bad news about pain management. The good news is that surgical pain gets better over time. The pain that you've been experiencing, which has probably been an 8 or a 10 or you wouldn't be having a joint replacement, only gets worse with time. You can have probably tried shots and pills and all kinds of things in there. Joint pain, when it's bone on bone, only gets worse. Surgical pain gets better with time. The bad news is I can't do 0 after major surgery. What most people do, not having therapy, are around a 4 to a 6 following surgery. But we will work with you on your pain management. Most people have an injection ordered that they can have if they really need it, but the majority of you will be, your pain will be managed with oral pain medications. The specific kind of pain medication that you have your nurse on the floor will talk with you about your options with it. Usually you can have supplemental pain pills that you have to request about every 4 hours. The shots you can usually have It depends on the doctor, but you will probably need a shot to get through the first night following surgery and then be able to transition to only oral pain medicine. One thing that I want you to do is talk to your nurses about it. We know a lot about pain management, and we can contact your doctor if we need to. The physicians order what works for most people. Because we're all human, you may need a dosage change, a frequency change, a drug change. We can contact your doctor. So please tell us, because we want you to be comfortable. Being comfortable helps with therapy. Therapy gets you out of the hospital and back to an active life more quickly. Trying things that aren't medicine will help. Music, video games, movies, a visitor, position changes, ice, those kind of things can be very beneficial to managing your pain postoperatively. When you're at home, continue to take pain medicine prior to activities, especially before therapy. Pain medicine takes about half an hour to start working, so take that. Remember, if you're doing outpatient therapy, to take ice packs in the car with you or to ice up at home if you're doing home health therapy. Don't drive while taking narcotic pain medicine, and remember to take it with food so that you have fewer side effects from it. You're going to need some help at home following your recovery for errands and your daily activities. One thing I want to caution you about is to use your walker as you're instructed. Once you get feeling better, which is usually pretty quickly following surgery, is you're going to start feeling froggy and not want to use your walker. If you're in your house and you have counters and chairs, that's a safer place to try walking without your walker than going outside. Outside there's pine straw, there's soft spots, there's cracks in concrete, and I always want you to use your walker whenever you're going outside. Falling is what we really don't want to have happen postoperatively. Don't sit for more than an hour at a time. Get up and move around, because moving around helps with swelling, helps with pain, and helps recovery. Also helps with your circulation and prevention of blood clots. Your incision care. When you're in the hospital, have your coach take a look at your incision, or what is even better is taking a picture of your wound. Healing wounds normally are swollen and a little red and a little warmer than the surrounding tissue. However, that's also some of the earliest signs of a wound infection, so you need to have something to make a comparison with. Your dressing is going to be one of several different kinds of dressing that we use, and if you don't have particular allergies, the most common dressings are all 5 to 7 day dressings, which means you probably won't have to do any wound care at all. If you have home health, those nurses will help you with your wound care. If you have outpatient physical therapy, the therapists often help you with the wound care. Whatever your bandage is, you will be instructed on what you need to do with it before you leave, but there's several different kinds of bandages that we use. Signs of a wound infection are a temperature of 100.5 degrees or greater, increasing pain, your pain should always be getting better, increasing redness, swelling, or drainage from your incision. Some drainage from your incision, if you're put together with staples, is expected. If you're put together with Dermabond, which is like super glue, you probably won't have any drainage at all. But until your wound heals up with the staples, you have a gap in between your skin. And because you're swollen and it's a joint and constantly moving, what happens is some fluid comes out on your dressing. The fluid, the drainage that you have, is normally clear and odorless. It can be clear yellow, clear red, or just clear fluid. Anytime it is colored or cloudy or smells bad, it's a call the doctor event. You can't take tub baths or swimming pools or hot tubs while you have an incision until the surgeon tells you that you can. If you notice any of these signs of a wound infection, this is a call your doctor, but we prefer that you don't go to an emergency room or an urgent care. Because if you go to an urgent care or an emergency room, there's plenty of sick people there with flus or other contagious illnesses, and we prefer that you contact your doctor and be treated over the phone or at the office. You can reach your doctor any time of the day or night. The way that you do that is that you call the hospital operator and say that you've just had surgery and you need to talk to your doctor. Even if it's 3 in the morning, you can do this. and they will page the physician on call in the practice that did your surgery, and they will call you back. If it's in the daytime, just call the office directly, and you'll be advised on how to manage whatever's going on with you. The blood thinners in preventing your blood clots, we want you to be cautious about cutting yourself, because you're on a blood thinner. You're going to bleed if you get cut. If you drop a glass, have somebody else pick it up. If you're doing dishes, don't have sharp knives in the bottom of your dish pan, and just be prudent with trying not to cut yourself. Signs of a blood clot can be your calf is warm and painful to touch. You may have persistent swelling that is increasing in your foot or your ankle or your calf. It is uncommon for shoulder replacements to get a clot in their arm, but it is possible to get a blood clot in your lower extremities. So you too need to be sure to move around and do your ankle pumps during commercials. Some swelling is very normal with joint replacement. As you move around during the day, the swelling will go down into your feet, so your feet will be larger in the evenings and smaller in the morning when you wake up. If your feet are bigger in the morning than whenever you went to the bed, pay attention. Does something feel worse than it did before? Does it feel different? Does my calf hurt? If the answers to that are no, then elevate your extremity, and chances are that swelling will come right on down. And odds are that you don't have a blood clot if your feet are bigger. But if you have any of these other symptoms, the different pain, the different swelling, call your doctor and let him know what's going on. The bad part about blood clots is that they can move. And if you get sudden or severe chest pain, call 911. But when you call 911, make sure you tell them that you just had joint replacement surgery. Because if you come into an emergency room saying you have chest pain, they're going to work you up for a heart attack, but we want them to work you up for a blood clot that may have moved too. If you have any questions, there's a phone directory in the guidebook that is online, or if you have the hard copy of it, and you feel free to call me, or you can call physical therapy, you can call pre-admission testing. There's all kinds of phone numbers in there for you to contact if you have questions, and we are happy to help you, and thank you for choosing Johnston Health.